Hi. Well, I hope you've all had a good lunch. It was very tasty. If you feel like going to sleep, go ahead. Try not to wake you up. So I'm going to be talking about disease-proofing your children with a plant-based diet. So what I'm going to do is I'm going to start a little bit about talking about myself and my journey with my children. I'm going to then talk about what we're fighting against when we're talking about childhood diseases. And then I'm going to talk about the optimization of our children's health from the very beginning, from day zero. And then I'll talk a bit about what we should be avoiding, particularly with the animal-based products and why. But that, I believe, has already been covered fairly well by my colleagues earlier. And then lastly, I'll talk about a few things that I did with my children that seem to help get the ball rolling towards a better health. So who am I? I was born in Canada, raised in 3 different states in the United States, after which I moved to Hungary to study medicine, where I've stayed there and tried to make a life of it. I worked in pathology, and I worked in radiology, and around that time is when, excuse me, when we moved to Ireland, where I worked in A&E for 2 years. And then during that time, I then moved back here with my family to the UK to study as a GP. So it may look like I've had quite a few different fields of interest, and that's because the path of life is a little bit different for everybody. And in my case, I was searching for that one thing that interested me most. And I eventually found that when we moved to Ireland, and that was the use of the whole food plant-based diet to help patients. And I realized I couldn't do that as a radiologist. So how did I get to where I am now? Well, my eldest daughter, who you can see flexing with those eggplants, is Jasmine. She is my eldest one. Like I said, she was born with Down syndrome. Now, the thing about Down syndrome is that medicine teaches us that they are more prone to diseases like obesity, thyroid conditions, digestive problems, Alzheimer's, recurrent infections, and many more. And as a medically trained doctor, I took all of those on board and did my best as what I thought I could for her. But by the age of 7, she had already gone through 3 major operations. And at that point, I had to take stock and reevaluate what exactly I was doing for her as a father. I didn't feel that I was giving her the best future possible the way I was going. So I knew something had to change. So what did I do? I talked to my wife. And she and I sat down and we explored the best thing we can do for her. And in the end, it came down to, well, the only thing we could do as parents was to provide her with the great opportunity to thrive with nutrition, with emotional support, and with spiritual support. So the nutrition ended up being the key linchpin to what we were trying to do. But the problem was there was no clear pathway. There's nothing that the NHS suggested we do, nothing that WHO at that time recommended. So it was kind of we had to try everything and figure it out. So we decided to do some research into it. And the more research we did, the more we found with very clear evidence that the whole food plant-based way was for her. So we were very happy. We thought, great, now we have something we can give her. But more importantly, with that research, we found that it would help everybody in the family, not just my daughter. And so what ended up happening is I took a closer look at myself and my wife, and I have a second daughter, by the way. Unfortunately, I didn't put a picture of her on there. No, I do love her, really. We looked at ourselves, and on the surface, we look like a happy, healthy family. But when you scraped away the top surface, I realized that we weren't as healthy as we could be. I had gone through 2 major operations by that time, and recently was recovering from a tuberculosis infection that I received from a patient. My wife was, after her second pregnancy, was struggling with persistent fatigue, anxiety, and panic attacks, which was later discovered to be Hashimoto's. And my younger daughter, who I didn't mention, who I didn't show a picture of, she had constant abdominal pains and was struggling with her digestive issues. So on the surface, it looked like we were fine, but when we dug a bit deeper, we were all struggling at different points, but we were still struggling. So we decided to embark on the whole food plant-based diet. And when we did, within a year, almost all of our symptoms disappeared. My urticaria, my constipation, my chronic reflux all disappeared. My mood, my sleep vastly improved. I felt healthier and stronger. My wife's symptoms had all disappeared too, and she was able to put her Hashimoto's into remission. My eldest daughter, her Hashimoto's was put into remission as well, and the constipation that she suffered from, the chronic recurrent infections, those all disappeared. I no longer worry about her physical health in the future because I know on a plant-based diet, she will be fine. And my youngest daughter, well, all her rashes and digestive issues, those settled relatively quickly, given that she was already in pretty good health. So why am I mentioning all this? Why is this important? Because our health is, to some extent, determined by genetics, but far more is it influenced by our diet, our level of exercise, our understanding of what is healthy and what is not healthy, what I term as health literacy, and medications. So this is even more so for our children, because we see, and I'll show later on, that what happens to our children as infants, as young adults, carries on and has ramifications as adults. So it's important, as they say, to start early. So what are we fighting against then? Over the last century, the primary burden of disease in children and young people has shifted from primarily infectious-based diseases to more chronic conditions. That means our children are developing old people diseases now as children. And it's become a very real fact. You see it on the news, you see it on literature, that obesity and diabetes is a real problem here in the world. And more importantly, they're starting to see heart disease markers increasing in children as young as 5 years old on a standard Western diet. So rates of cholesterol, blood pressure, cancer, liver and gallbladder disease, all of these are increasing. Breathing problems like asthma, skeletal muscular problems like pains in the joints, anxiety and depression, which, by the way, low self-esteem and bullying, that also goes under the self-harm bit as well. And skin-related issues like eczema. They're all on the rise, every single one of them. So what we're fighting against, in essence, is poor eating habits, poor health literacy, and a sedentary lifestyle, which in essence is diet and exercise. So just to make that point, there was a BMJ article in 2018, February 2018, and they had some really interesting statistics I wanted to share. First, in the UK, a third of all 10-year-olds are overweight or obese. That's 33%. 25% of all 5-year-olds have tooth decay, which is insane considering that they shouldn't be having it. And the worst one, I think, one of the more striking ones, is the self-harm one. That the self-harm amongst girls 13 to 16-year-old has risen by 66% in the last 3 years compared to 2015-2016 time. 66%. Teenagers, they also mentioned, if they're at the upper end of a normal body weight, are substantially at risk of becoming the substantial risk for premature death in adulthood. And 80% of obese children will remain obese as they become an adult. And that directly leads to them losing 15 to 20 years of their healthy adult years. Those are the years where they are healthy and strong, productive to society, able to play with their children, go out with their friends. Those years are gone. Those years are lost. The other thing we'd be fighting against is early onset of menarche. Menarche is the first period that a young girl has. It's interesting data, but over the last 100 years, it's well documented that the average age of onset has decreased by 5 years, from the age of 17 to 12. Now, there's a lot of theories as to why: urbanization, economics, ethnicity, so on and so forth. But the one factor that seems to be the most amenable to change is nutrition. The other thing is, this is important that we mention this, because the earlier onset of menarche means earlier onset of estrogen and progesterone and the flux of hormonal imbalance within the body, which means that there's a possible longer association with breast cancer and ovarian cancer, and risk of what psychiatrists refer to as altered social behavior, which is generally seen in the teenage years. It was an interesting prospective study that was done. It's a small sample size, but it was very telling that menarche occurred earlier in girls who were taller and who consumed more animal-based protein and less vegetable protein at the ages of 3 to 5. So as early as in the first 3 to 5 years, the ingestion of animal proteins can potentially lead to an early onset of menarche. Now, this has to be taken with a grain of salt. There are other factors involved, but we can only properly account for the dietary aspect. Now, in that same article, they referenced 2 other studies that made the same conclusions using slightly different models. But it's interesting to note that even with the different models, they still came to the same conclusion, which makes us wonder if we can decrease the amount of animal proteins our young girls are ingesting from an early age, from day 1, will that help them delay that onset of menarche to a healthier age? Constipation. It's a common problem with our youngins. And it's a common problem with some of us as well. But it's interesting to note that with children, chronic constipation reportedly has a lower quality of life scoring than children who have inflammatory bowel disease or gastric reflux. 1/3 of all of our children in the UK were constipated at one point. And it's even worse in Ireland, unfortunately, where 5 to 8-year-olds, in that age range, we see constipation, it doubles dependent on inadequate versus adequate fiber intake. So like our colleague Desmond, Dr. Desmond said earlier about fiber, it is very important not just for bowel motions, but for the overall health of the microbiome. And that's what this is getting at. So the things that we're talking about regarding childhood illnesses, the big ones I'm going to talk about, obesity being one of the biggest ones. And the reason why it's such a problem is that, as the graph shows, the rate of obesity hasn't stopped. It is continuing to rise, and there doesn't appear to be any ceiling on it at this moment. Now, these studies have come from the United States, but as you're going to see worldwide, the developed countries generally all follow this pattern of behavior. So children, this is not unknown knowledge, but it is well documented. Children who are obese are likely to become obese as adults. And children who are obese now will have more severe risk factors for obesity as adults, and more importantly, those symptoms and diseases can be more severe. And one of the reasons suggested was not just the food, but also the culture and the technology. As it becomes more ubiquitous, as our culture becomes more ubiquitous, the same kind of triggers will be seen throughout different regions. So what kind of complications are we talking about in childhood obesity? Well, everything from psychosocial, like poor esteem, depression, and eating disorders, all the way down to renal, endocrinological, and skeletal muscular. It literally affects every part of the body. Diabetes. It is a growing epidemic. You hear this all the time. According to the WHO, type 1 and type 2 diabetes in children is on the rise. And the incidence has been increasing by 4% each year, particularly in children under 5, with a 5% increase in this age group over the last 20 years. The most staggering are the last 2 statistics, which is 85% of people are diagnosed with type 1 diabetes have no family history, which kind of rules out that whole genetic aspect of it. And lastly, probably the most astounding, is that UK has one of the highest rates of type 1 diabetes in the world, and we have no idea why. There's been no understanding, there's no direct link. I suggest maybe it has to do with the diet. Asthma, that's another big issue with children. We see that on the rise as well. 1 in 11 children in the UK have asthma. That means basically 3 children in every classroom will have asthma. And the UK has one of the highest prevalence rates of asthma worldwide. And as you can see, every 20 minutes a child is admitted into hospital for that. So a very serious condition. Just so you know, asthma is labeled as a life-threatening condition when the patient is having an asthma attack, so it is very serious. And eczema, while not as life-threatening as asthma, it is a common problem. As you can see, 20% of children worldwide have eczema, and 1 in 8 children in the UK is affected by it, which means about 1.7 million children overall. And the number doesn't appear to be slowing down. Just like everything else I've mentioned here, it's on the rise. 70% of children who have eczema, it starts when they're 5 years or younger. And more importantly, 60% of all children who have eczema when they're infants carry one or more of those symptoms into adulthood. So what's driving all this? Well, as I mentioned before, it's a combination of things. It's environmental issues. We are polluting our environment a little bit more than we should be. It is stress levels from work. It is the inability to manage proper food for the children. It is a lack of an active life. It could be any number of things. But in the end, there's only a few things that we, as parents, as healthcare professionals, can control or hope to control, and that is the nutrition. As we've heard from my colleagues earlier, nutrition is the linchpin of a proper, healthy human being. And more importantly, it is so for children. So I propose we turn our children into the Matrix boy, right? Who has the superhuman power to stop bullets before they hit him. That means he stops those things that will cause him harm. Fatty foods, processed sugars. He will have the confidence then to resist the marketing hype, the peer pressures, and more importantly, those lifestyle modified diseases like obesity, like diabetes. So what can be done? Well, Connor here is part of the dietitians of Ireland, I believe. Unfortunately, I don't see their logo up there. I wish they would. But the whole food plant-based diet is well recognized by these associations as being adequate at nearly all stages of life, particularly, as Connor mentioned, the American one. Each one of these organizations agrees that there is a place for a whole food plant-based diet. Just hope in the future that more associations will follow suit. So when it comes to our children, the place to start with their health will be before they're even conceived. Because as we've heard before, the mother's health directly influences the child's health. So pre-pregnancy preparation, this is what I call it. I couldn't think of a snappier word for it. So it all comes down to a wide, varied diet. Diversity is the key for any person who is going to be on a whole food plant-based diet. Diversity is the key. Do not get stuck into the rut of just a few vegetables, a few fruits. You have to eat all types of fruits and vegetables, nuts and seeds and the whole lot of them. So as the saying says, eat the rainbow. And as we've mentioned, as Connor has mentioned earlier, there's a lot of nutritional benefit to plants, eating plants and nuts and seeds. I'm going to just add on a few more bits, saying that it helps bolster the body's immune system. It helps clean the body out of toxins. It keeps the weight low, which then helps stabilize hormone levels. And it's important about the toxins because some of the toxins, particularly the pesticides that we are using in our environment, particularly with farming or keeping crabgrass under control, those tend to be fat soluble and are retained within the fat. So the more fat you have, potential for retaining more pesticides. So it's important that the mother reduce how much potential toxins are in her body so that they cannot affect the child as they are developing. So during pregnancy, as was mentioned before, a wide complement of minerals and vitamins can be achieved from a plant-based diet, with the exception of B12 and iodine. Thank you very much, guys. I forgot to mention that earlier. The thing about protein deficiency, as was mentioned before, is not true. It's been widely disproven. So the protein profile, the nutritional profile, is almost as complete as it can get. You just need to make sure you eat enough to ensure that you get a standard caloric intake. It's very simple. It's not rocket science. But some interesting studies have been done to show if there's any increased benefit of being on a plant-based diet versus a standard diet. So it was interesting to note that in 2002, the study showed that the vegan pregnant woman had a lower than average ratio of risk of cesarean section, postpartum depression, and a lower neonatal and maternal mortality. In addition, another study showed that a vegan mother generally, on average, has a lower rate of a preeclampsia. Preeclampsia is a dangerous condition, can be a potentially dangerous condition where your blood pressure starts to increase, which can then compromise the fetus. And they found that the fruits and vegetables, cereals, and dark breads were one of the what was the most beneficial part in reducing this risk. Calf cramps. They are primarily a third trimester issue with pregnancy, and they found that being on a plant-based diet actually reduced this symptom. And the fetal growth weight. So 2 studies were done that actually showed the same thing. One, which was a fairly large study from a Danish group, that showed that there was a very strong association between a high greasy lean vegetables and fruits and the birth weight of the children. So in the end, there was a preventative effect against gestational related problems and an improved fetal growth rate. So which is very important for obviously both the mother and the infant. Also, they found that whole food plant-based diets improve protection against toxic substances that would affect the genetic markers of the cells. Particularly one of the more common ones being the PAHs, which are the polyaromatic hydrocarbons. That's the stuff you burn off from fossil fuels. That tends to be very endemic in the environment. It's probably the most common gene-affecting toxin, and the plant-based diet has an excellent protective effect against that. And the last one there is one of the more insidious ones that I see a lot. If you look at any processed meat in your store, just flip over the back and take a look at what the ingredients are. Chances are it has some kind of a nitrate or nitrite in it to kind of preserve the meat. Well, there's been direct associations between this compound and higher risks of neurotube defects and pediatric brain tumors. So we definitely want to try to obviously remove that from our diet. And since you don't need to preserve fruits and vegetables with these nitrates, you're obviously not going to get them. So after the child has been born, it is the natural proclivity to provide breast milk for the child. It is by far the best food for a child. The WHO recommends 6 months exclusive breastfeeding with up to 2 years of continual breastfeeding for the child. Now, in the UK, I believe the recommendation is up to 1.5 years. But it's interesting, I was wondering why 2 years, why that specific number? Why not 1.5 years, why not a year? Well, it turns out that in the development of the neonates or the infant's guts or the bowels, the junctions between cells remain open until the 2nd year of life. By that time, those junctions, which are called gap junctions, become tight junctions and seal. So this is the nature's way of ensuring that the child gets all the immune benefits from the breast milk, as well as develops that taste and begins to see the bowels with normal bacteria from food that it's supposed to be eating. So it's important that the breastfeeding continue as long as possible, and the recommendation by the WHO is at least twice a day while complementary foods are introduced after the 6 months of age. So it's an interesting study that was published in The Lancet in 2016 that showed 81% of UK mothers have tried breastfeeding at some point during pregnancy. Tried. And by 6 months, only 34% remained breastfeeding. And by 12 months, only 0.5% were still breastfeeding. As opposed to the United States, where the numbers are a bit higher. Where 79% started, but 49% continued after 6 months, and 27% continued after 1 year. Ironically, the UK has the worst breastfeeding record in the world. If you don't believe me, that's the statistic that came out of that study. We're under Saudi Arabia, Denmark, and Greece. That's not a place where I'd want to be. So why is breastfeeding so important? Why am I spending so much time on this? Because it is the first food the child drinks when they're born. It is the most complete food the child will ever have in their life. It has the perfect ratio of fats to proteins to carbohydrate. It has all the nutrition a child will need, and it has, on top of that, a full complement of immune modulating components to protect the child from infection. That is why the WHO recommends to continually give the breast milk after 6 months, to continue up to 2 years. But that is all hinged on that highlighted bit, where the amount and the types of vitamins in the breast milk is directly related to what the mother is taking in. If the mother's diet is substandard, the child's breast milk will be substandard. And to add on to that, if the mother is drinking dairy, she's producing antibodies against that, and then that has been directly associated with episodes of colic in children because they undergo symptomology, ironically. So there are cases where women can't produce breast milk. That's fine. It happens. In today's standard, or by today's standard, we will start giving them formula milk, which is predicated on the bovine milk. Now, formula milk does share some similarities to human breast milk, but it has different concentrations of proteins to carbohydrates to fats. And in addition, the vitamins and mineral compositions are not as ideal. But the most important component to this is there's no antibacterial component to formula milk. It is a sterile food. And that's not how the human body was designed. It doesn't need that sterile food. The other thing about formula milk is that iron deficiency is more likely to be seen, and up to 28%, as I said, of children will suffer colic as a result of those antibodies being formed. The interesting thing about this is that while we know breast milk is very vital and is a superior form of food, the UK government has set up banks all across the nation to accept donor milk from mothers who no longer have a need to give it to children but are still producing milk. But those banks are heavily guarded, and they are only given to those children who are at severe risk of malnutrition. So very premature children or very sick babies. But interesting enough, as with all of things that we're talking about, there is a growing movement for a healthier option. And it started in the United States, and it's now become a global website called onlythebreast.com, where they provide donor milk from women who no longer need the breast milk because their child has outgrown it. They also have women who are wet nurses. So if you're in the same area, that is an option as well. So moving on to after the first 6 months, where the child was only exclusively fed breast milk, now they're beginning to teeth, now they're beginning to want to eat solids. So this is the pivotal moment. Everybody knows you need to start a child early to get them to eat well. So it starts here. They need to get the taste for all types of vegetables. Some are better than others. So in the beginning, you want to start with something very simple, very easy to digest, something that you can mash up, and that's very good for them. You want more vegetables than fruits. That would be the ideal. You don't want to get them hooked on the sugars too early. The reason I bring all this up again is because studies have shown that as you stay on a plant-based diet, like in the study, the vegans tend to be thinner with lower cholesterol, lower blood pressure, and a lesser risk of heart disease. And that's what we're trying to aim for. We're trying to aim for our children to have a better, healthier future. Other thing about that is higher energy intakes during complementary feeding after these first 6 months was associated with higher BMI in childhood. And what they also found was that the family diet may have a greater importance in terms of long-term health outcomes for the child. So this means that, yes, feeding a child vegetables is good, but more importantly, it's what the child sees you eat as well. If you're eating a steak and trying to push a broccoli in his face, that's not going to go over too well. Children are really smart. They pick up hypocrisy really quickly. And you all know what I'm talking about. So you need to practice what you preach. You need to ensure that you're eating the same things they are. And more importantly, you need to genuinely enjoy it, because they can spot a fake a mile away. So after transitioning from solid foods, after the transition to solid foods for a child, you've begun the process of establishing a good, healthy relationship with vegetables. And that needs to carry on for the rest of their life. Now, it does become more problematic as they reach the social years, where they start going into schools, they start meeting other kids, And then they start realizing there's something called Haribos and chocolate and all these other things. So it's important that you stay mindful of that and try to keep that in mind. Try not to push them too hard, because that will, in essence, push them away from you. So I bring this all up because we can do better. 1 in 4 secondary school children and 13% of primary school children consume less than half a portion of vegetable per day. And we adults are no better. We only, on average, half of us only get 2.3 portions of our 5 a day. So it's important as educators, as teachers, as health professionals, that we try to do better and spread the good word. So the things that we should be avoiding are those plant-based foods, the meat, the dairy, and the egg. And why? Because meat, by the WHO, has been classified as a class 1 carcinogen, and that is the processed meats, the sausage, the salamis, and bacon. That stuff is shown to cause cancer. Well, every other meat, other than chicken and fish, is classified as a group 2A, which can probably cause cancer, but we're not totally sure right now. Other reasons to avoid meat is a higher rate of infections. In the United States, 70% of all food-related poisonings were due to contaminated animal flesh. In the UK, we had 500,000 cases in 2014. Further reasons is a direct link between heart disease and diabetes, and difficulty in maintaining a lower BMI, in addition to all the hormones that are found within these meats, both that come naturally and that are added in, unfortunately, in addition to the heavy antibiotic use for these animals, which has been known to cause obesity in living organisms. And lastly, the risk of cancer to colorectal, bladder, prostate, and an overall death rate increase. Dairy needs to be avoided at all costs as well, because as you've heard from my previous colleagues, that it has effects. But more importantly, it is directly related to an increased BMI in children. And particularly, there was a study done that showed that even skim milk, which is the lower fat version, is shown to raise insulin-like growth factor 1 and insulin secretions, which are thought to promote adipose simulation. And this has been directly related, or this is directly seen by an increased obesity rates in children who are formula-fed versus those who are breastfed. In addition to this, total dairy intake nearly triples the odds of developing colorectal cancer in an adulthood. And the dairy products are, as we've talked earlier, are high in fat and cholesterol, which the body does not need any of. It can produce its own. And of course, as I said, it's linked with other cancers. One last thing. The cow's milk is laden with hormones, antibiotics, pesticides. Just like the breast milk, it's supposed to accumulate all those things that a cow needs to grow. But it also accumulates all those things that we as humans don't need. And the problem particularly is with the pesticides, because those, like I mentioned earlier, accumulate in the body over time. And so while they may not show up in childhood, they will definitely show up in adulthood. And this is one of the things I think is happening with us, is because we as a people are showing more immune, reproductive, and central nervous system damage, which is coming through with the increased rates of some of our diseases. It's an interesting note that people keep saying we need to have milk for strong bones. Not true, as a 2005 pediatric review clearly stated. And the last thing I wanted to show about dairy is that there was a study showed that 24 asthmatics were put on a whole food plant-based diet for a year. 92% of those patients reported improvements with a significant decrease in their symptoms, and nearly all the cases, medicines were removed or drastically reduced. The last thing I want to talk about is the egg, the incredible, inedible egg. One egg has the same amount of cholesterol as a Big Mac. So every time you're giving your child an egg, you're giving them a Big Mac. That's pretty much how it works out. You're increasing gestational diabetes risk by 165%. You're increasing diabetes risk. You're increasing colon cancer risk. The data has been there for a long time. It's just being confounded by, unfortunately, interest groups. And the last one I wanted to mention is that eggs, along with cow's milks and peanuts, is one of the most common causes of anaphylaxis in children. So there is an allergic response to that. So Dr. Desmond already mentioned about the high fiber content and why it's important. I just want to touch on that briefly, because constipation is a big issue, like I mentioned earlier in a study, that 1 in 1/3 of all children in the UK have had constipation. This is the United States, and like I said, there's a lot of similarity between the two cultures. But as you can see, the age groups, the fiber intake is in the low teens for most of the young child's life. The actual recommendation is they should be in the 20s and 30s. So there is a significant deficit of fiber. And there are some thoughts that think that fiber alone will manage our obesity issues and our rate of diabetes. There is something to be said for that. So to recap everything, this whole conference today has been about explaining, convincing, showing that a plant-based diet is the superior diet. And we've seen it for adults, we see it now for children, and I just hope that you're able to take this back with you and use it in your own daily life or in your own practice.